Hey everyone, this is Bob and Joshi here. Was hoping to share with you guys a brief overview. Hey everyone, this is Bob and Joshi here. Was hoping to share with you guys a brief overview of EPIC in the outpatient setting, particularly as it pertains to FHCN ambulatory clinic. The purpose of this video is to primarily describe the various features and tabs that you can utilize to help improve your efficiency in terms of review of the chart and getting the pertinent details about what's going on with the patient. This is kind of the general overview that you would see when you open a chart for the patient. Over in this section right here, you'll find all the patient demographics, as well as the age, date of birth, etc. Below that is the COVID tracker, which would be various colors depending on their positive status, whether they're unknown, etc. There. Below that is where you'll find the provider name, if there's an attending provider that is the primary care provider. And then oftentimes for our clinic, you'll see the resident PCP, which may be yourself or one of your colleagues that's in the same pod as you guys. Below that, you'll find the vitals section, which will, if the visit is ongoing, then this will be the most recent vitals from this current visit, or the visit, or the vitals from the last visit if you're opening the chart prior to this clinic visit. Below that, you'll find this section in the which is particularly useful. It's called the care gaps, and this will list all the different healthcare maintenance related reminders that may need to be addressed. As you can see in this patient, there's quite a few topics that need to be addressed for this patient. Another important and useful thing within this section is these results, which will notify you if the patient has had abnormal results. This particular section is particularly useful when you're dealing with when you're reviewing pap smear, as this will show you if they've had a abnormal pap in the past. Same thing with colon cancer screening as well, where it will be listed. One thing to note, however, if the overall study is benign, oftentimes the year listed here can be inaccurate. For example, if a patient has some polyps but nothing particularly cancerous, this may still say 10 years. So it's really important to still review the report to ensure that the appropriate follow-up is addressed for the patient. That's primarily what you'll cover within the sidebar of the EPIC layout. And then next up, I'll be reviewing some of the tabs and some of the various utilities that can be found there. Probably the most bang for your buck you're going to get is through the chart review, which will allow you to look into all the previous tests and notes that have been that the patient has had. This encounters tab is it will include all the visits that the patient has had, which would include ED, hospitalizations, office visits. And the other thing that this tab has, which the notes tab may not, is if there were various encounters with the MAs for if the patient called in regarding some medication issue, etc., that may not always be listed in the notes, but will be listed here in the encounters tab. Next up I have is the notes tab, which will include all the pertinent notes that the patient has had. The filters section can be used to focus on specific topics that you may be looking for. So if you go to service, you can, this will show all the specialists the patient has seen, including GI, cardiology, etc. And you can click on them and go to only focus primarily on the cardiology notes. Another tool that you can utilize in this particular filter section is if you notice that you tend to use a particular filter fairly often. Say you tend to look for only the clinic visits, you can actually save as a new filter. And it will pop up right here so that for future reference, you can always just click on clinic and see all the clinic notes that the patient has had. Remaining, in addition to that, there is the labs tab as well, which will show you all the various labs the patient has had done. There's two ways to go about reviewing the labs. There's this viewpoint, which will show you most recent labs and previous labs in a trend format. And then there is this view, which will show you what has been ordered most recently for the patient and whether it's been completed, but not necessarily in the typical format of a table that was seen earlier. This is also a way to access imaging, some procedures if the patient has had any, cardiology related topics, EKGs, echoes, left heart caths, and then the media tab, which will have a lot of documentation that may not necessarily fit into any of these other categories. So some of the send out labs will be located here, referral documentations, other paperwork that's been done oftentimes will get scanned and uploaded to the media tab. So it's a worthwhile location to look if you can't find what you're looking for. Those are primarily the big tabs that I use within the chart review section. One more that I do think requires a highlight is the referrals tab. So this will show all the referrals that have been placed for the patient and whether they've been approved, whether they're still pending. And if they're still pending, then you can click on it to see where maybe the holdup. And if you run into some issue, then you can reach out to Angela in the referral section and try and get it rectified. Next section I have is the review flow sheets, which primarily is useful for the purpose of looking at trends of various things. It can be used for vitals, it can be used for BMI, weight, etc., but also stuff like PHQ-9. So you can use it to trend the depression screening that's been done for the patient. Next tab is the snapshots tab, which is a good way to quickly review some of the pertinent information about a patient. And another useful aspect to this tab is that it allows you to quickly see some of the deficiencies in care coordination or care that our patient is dealing or that have not been addressed but for this patient, and will allow us to quickly figure out what may be some topics that we want to discuss with our patient during this visit. This is also another place where the healthcare maintenance is listed as is in the care gap section. As with most things Epic, there are many different ways to go about doing the same thing. So you just have to figure out what system works best for you. Again, this also includes medication. So it's a quick way to review all the meds, problem lists, other significant social history related information, immunizations. So a lot of the stuff that we already just saw, but all in one place, but not necessarily something you can interact with in that you can, make changes to what's going on in this section. What I find to be a little bit more useful for my own purposes is the plan tab, which, similar to the snapshot, has a lot of the similar information, including, the allergies, medications, problem lists, but it also has a special medication management section, which allows me to quickly look through to see when the last prescription was placed, also see how many refills they have. If I see that they're running low on the refills or it's been 11 months and this is about to run out, I can click just right here and refill the medication. And it will give me all this information, and you accept and you can sign up. Just below this, the medication management section is the smart sets. Another very useful tool amongst in Epic is so you can find, for example, the FHCN diabetes smart set, which will show you, all the pertinent labs you might want to order, It will show you medications that you may need to order, glucometer, the types of insulins, SGLT2 inhibitors and DPP4 inhibitors. All of this information, all of these medications can be ordered just through this to make it more quick and more efficient rather than going through the orders tab, which I'll get into in a little bit. Other than that, one other tool that I wanted to highlight within the plans tab is the problem list, which can be particularly useful when you're trying to communicate to either yourself also or your colleagues in the future regarding a problem that may have a prolonged history. For example, may not necessarily be as useful for hyperlipidemia, but this overview section can be very useful in people who have chronic conditions that have a complicated course. For example, if a patient had rheumatoid arthritis and they had a whole list of complications and multiple medications that have been tried on the patient, this is a place where you can put all of these pertinent details into the overview section, so that if a provider at a later point needs to brush up on what has been done for the patient in the past, they can quickly review the overview tab and figure out exactly what the patient needs next and what's been done for them in the past. Inside of these tabs, one tab that I also find to be fairly useful but not listed here just due to the limitations of the Hyperspace learning module that I'm using is the wrap-up tab, which is used primarily in the setting of ending a visit, and it will give you a section where you can put in patient instructions as well as do your billing in one visit and sign. And the last thing I wanted to share with you all within this video is where the orders and diagnoses are located. So this section right here is your orders, and particularly when you click on this button right here, it will lead you to your smart list where you can find all the labs that you may want to order, and you can quickly just click on them. Making it a habit of going through this way ensures that there aren't any errors in how the labs are ordered, which can oftentimes lead to the labs being canceled. This also includes imaging, immunizations, referrals, as well as some medications. However, I do find that oftentimes just typing out the medication you're interested in getting is a much faster way than necessarily going through the smart list for that particular purpose. In addition to that, this is the section for diagnoses. So this is an easy way to review previous problems if there's something that has already been listed as a problem in the past that you're planning to address during this visit. So you can add hypertension, primary hypertension, except, and add that as a problem. This diamond right here tells you which one is the problem, the primary problem that was addressed in the clinic visit, and allows you to quickly add some of the more commonly used problems, previous problems, or you can just type out whatever issue may have been addressed during the clinic visit. And once you're done with your orders and your diagnoses, you can go to the sign section and associate the diagnosis with the particular medication you're ordering, and change provider to add the attending provider to your order, and sign the order. All right. Well, I do hope this video was informative, everyone, and would love any feedback that you have on how I can make these videos more useful to you guys. Thank you.